Hi, my name is Dr. Constance Scharff, and I'm here to welcome you to the Addiction Treatment Show's first live on-air broadcast. I am the Director of Addiction Research and Community Education for Cliffside, Malibu, a leading addiction treatment center in Malibu, California. And today I want to talk about the questions that you need to ask when you're choosing a rehab center. And the first thing that comes to mind is, how do you know when it's time to choose a treatment center? Because I think a lot of people wait far, far too long. There's this idea that is sort of hanging around in the world, in our communities, that someone needs to hit bottom before we should seek addiction treatment. And that's simply not true. If someone shows that they're getting higher blood sugars, we start diabetes treatment immediately. We don't wait until there's a diabetic coma. When someone starts to show a propensity for high blood pressure, we start treatment immediately. We don't wait for a heart attack. So it's incorrect thinking that we need to wait until someone has overdosed, lost their home, lost their job, all of those negative things that happen before we start with our addiction treatment. So what are the red flags that someone that you love needs addiction treatment? And the first is that there are consequences for their actions. They're starting to have minor brushes with the law, difficulties at work, medical situations that are starting to arise, so that we know, hey, this drinking or using is starting to get a little bit out of control. The second thing that you should look for is social isolation. When people are no longer hanging out with the friends and family that they used to hang out with, and they're starting to withdraw from the people that they love and hang out with new folks that y'all don't know, those are the warning signs that we have a problem on our hands. And you want to get to the problem before there is, there are greater consequences, because the further along the addiction treatment, ladder we go, we let addiction progress, the more difficult it is to treat, the more expensive, the longer term, et cetera, and so forth. So I get emails every week from parents, spouses, employers sometimes saying, what do I look for in an addiction treatment center? I know what to look for if I want a new car. I know what to look for if I want a new refrigerator, but I don't know what to look for in addiction treatment. So here are some questions that you should be asking yourself as you're looking online at different treatment centers. And then very specifically, when you're speaking to an admissions counselor, these are some of the questions you should ask to make sure that you're going to a high quality center, that your loved one is going to a high quality center. Because there's very little regulation in the addiction treatment field. And I want to make sure that wherever you go, whether it's to Cliffside, Malibu, or somewhere else, that you're getting the addiction treatment that your loved one needs. So what should you ask? Well, number one, first of all, ask, do you have a bed available today? So many addiction treatment centers have wait lists. In most parts of the country, there are fewer beds than there is demand. And people wait weeks, months to get in. And every day that you have to wait is an opportunity for your loved one to die. Because so many people are abusing opioids that the risk of accidental overdose is extremely high during a wait period. It is not uncommon for an addiction treatment center to have a wait of a couple of days, maybe even as much as a week. That would be realistic, shuffling people around, making sure there's a bed available, knowing when discharges are coming up, etc. But if you have to wait longer than that, you need to keep looking for another addiction treatment center. You need your loved one to go right away. Second, ask, what is your success rate? Most addiction treatment centers actually don't track that. It is not something that was required. But one of the things that you want to know with any sort of medical treatment is, how successful is this program? If you've got cancer treatment or diabetes treatment or heart disease treatment, you'd want to know, hey, what's the success rate for this before you get involved with it? So ask that question. What is my extended length of stay? I'll tell you, insurance generally is not covering a full length of stay for an addiction treatment center. So you have treatment centers that say, right, we're going to use a 28-day model. Everybody knows that's not effective. People don't get better from addiction in 28 days. So why do we have that model? We have that model because that's what insurance agreed to pay for. What you really need to ask is, how long is this treatment going to last so that my loved one actually has a real shot at recovery? And most treatment centers are going to tell you 90 plus days. So you know going in, right, insurance is going to cover maybe 30 days, maybe 6 weeks. And then, you know, you ask how much is the cost for this treatment so that you know what the family's portion is actually going to be. So how much is this treatment? Then we can work with your insurer to pay for part of it, most of it. And then you know what the family's actual expense is going to be. But if you know what the success rate is, you can feel confident, right, that you're paying for something of quality. You want to know if they take insurance and what insurance they take. Most treatment providers, if you have private insurance, will call up and will work your insurance to find out exactly how much care you can get. That's something that any reputable treatment provider will do. We certainly do at Cliffside Malibu, and it's not something for you to try to negotiate, but for the treatment provider to do. But let them know, here's my insurance information. What can you get paid for? You want to know the level of licensure, if any, that group leaders have. So the best treatment centers are going to have a lot of individualized care, a lot of individualized counseling sessions, but most of what is going to be provided is group work, right? Because you can't sit in one-on-one counseling all day, right? Your mind would explode. Like, nobody can do that. So you have a lot of group sessions. You want those groups to be very small, right? If you have 20 people in an hour-long group, how is anybody getting any benefit out of that, right? And you want to make sure that the people are licensed. So the more the licensure that you have, the more expensive the treatment center is going to be. So if you have a group that's led by a tech, and that's going to be someone who's maybe a year or two sober but has no qualifications, that's going to be a lot less expensive, but also less effective than if you have a group, even of the same size, that's led by a counselor, you know, a master's level licensed counselor. So you want to ask those questions, and you have to balance for yourself the quality of care and the quality of the licensure and the quality of the group leaders with how much you can afford. What does a typical schedule look like? The very good treatment centers are going to have very busy schedules, and they are going to be individualized for your loved one. So they might have individual therapy, they might have acupuncture, they might have a couple of groups, but you want that schedule to be packed. Why? Well, because if insurance is limiting how many days you can stay in treatment, you want to make sure you're getting the most out of those days. If there's a lot of swimming, free time, not that people shouldn't get exercise, we certainly have that in our program, but you don't want your loved one to sort of waffle around during most of the day when they really need to be getting everything they can out of their experience. Is your facility licensed for dual diagnosis? This is a critical question to ask. At least 50% of addicts have some sort of co-occurring psychological issue, usually depression, anxiety, ADHD, attention deficit disorder, or PTSD, post-traumatic stress disorder. Those are the most common co-occurring disorders, but certainly we treat others. But yet a very small percentage of addiction treatment centers are actually licensed to treat co-occurring disorders. If your loved one has a co-occurring psychological disorder with addiction and they are not treated concurrently, the odds of success are very low. So if you know that your loved one has anxiety, depression, a background of trauma, or some other psychological disorder and addiction, they need to go to a treatment center that is licensed for addiction, or for co-occurring disorders. You want to ask, does the treatment center have specialists for pain management, physical pain management, and trauma? So many people nowadays are addicted to prescription opioids, painkillers, and then switch over to heroin and other street drugs, that we really have to look at pain management in addiction treatment. Why is this? It's the same reason for the co-occurring psychological disorders. If we only treat the addiction, but we do nothing to manage the pain that a person is in, and work on an aftercare plan to manage that pain, then we're not giving them the tools they need to stay clean and sober when they're out in the world. So knowing that trauma services and pain management services are available if needed in that treatment center is critical when you're choosing someplace. And finally, you want to know what involvement in aftercare the treatment center has, and how it is that they handle relapse. So when a person leaves treatment, very often from us, they leave treatment, people leave treatment prematurely because their insurance cuts out and they just can't afford to stay any longer. If that person then relapses, does the treatment center try to bring them back? What support is there? What kind of an aftercare plan is created? From our treatment center, you'll have at the very least an appointment set with a psychotherapist in your local area when you leave treatment. I mean, we really want people to be successful, and the quality treatment programs want that. So you're going to get a very detailed aftercare plan on what do you do now that you're no longer in the confines of the treatment center. And then there should be some idea of, all right, if the person relapses, what do we do? What are the next steps? And not leave them floundering. I hope that I've been able to answer some of your questions today about how to choose an addiction treatment center. And I just want to say again to you, don't wait. The sooner that you seek help for your loved one, the earlier that we can arrest addiction in its process of worsening, the better the results are likely to be. I hope that this has been informative for you, and have a great day.